Sungguh beruntung orang-orang yang beriman kepada Allah. Sungguh beruntung pula orang-orang yang senantiasa menuntut ilmu, karena mereka sedang mendaki menuju derajat yang lebih tinggi. Sebagaimana yang telah Allah janjikan dalam Al-Quran Surah Al-Mujadalah ayat 11, yang artinya, niscaya Allah Subhanahu wa Ta'ala akan mengangkat derajat orang-orang yang beriman di antaramu, dan orang-orang yang diberi ilmu beberapa derajat. Universitas Islam Sultan Agung Unisula yang didirikan oleh Yayasan Badan Wakaf Sultan Agung pada 20 Mei 1962 di Kota Semarang, Jawa Tengah telah berkontribusi penting di dunia pendidikan dan kini terus tumbuh dan berkembang, bertransformasi menjadi Universitas Islam terbaik di Indonesia. Alhamdulillah saat ini di bawah kepemimpinan Rektor Profesor Dr. Gunarto SH.MH, Unisula berhasil meraih akreditasi unggul dari Badan Akreditasi Nasional. Dalam proses pendidikannya, Unisula yang berbasis Islam berkomitmen penuh mencapai visi mewujudkan generasi khairul ummah. Generasi khairul ummah merupakan generasi terbaik yang dicita-citakan, generasi yang beriman, bertakwa, beramal soleh, menyeru kepada kebaikan, dan mencegah kemungkaran. Untuk mencapainya, Unisula senantiasa istiqomah menerapkan budaya akademik Islami serta konsep kampus Birrul Walidain, sehingga diharapkan akan tumbuh generasi yang kompeten, berhati mulia, juga peduli dan berbakti kepada kedua orang tua. Di usianya yang lebih dari 60 tahun saat ini, Unisula memiliki 40 prodi yang mayoritas terakreditasi A dan unggul. Selain terakreditasi nasional dari BAN PT, sebanyak 13 prodi di Unisula juga mendapatkan akreditasi internasional dari Accreditation Service for International Schools, College, and Universities (ASIC) yang berbasis di London, dan terakreditasi dari The Alliance on Business Education and Scholarship for Tomorrow, a 21st Century Organization ABES 21 yang berpusat di Tokyo, Jepang. Unisula didukung oleh para pengajar terbaik di bidangnya, yang telah mengukir berbagai prestasi nasional dan internasional. Unisula juga terus berkomitmen memberikan layanan pendidikan terbaik dengan meningkatkan kualitas sumber daya insaninya. Salah satu ikhtiarnya diimplementasikan melalui program mencetak 100 profesor pada tahun 2027 mendatang. Unisula merupakan kampus teladan dalam pengelolaan kampus yang ramah lingkungan, berkelanjutan, dan berkomitmen mewujudkan kampus yang green, eco, dan smart. Memiliki teknologi informasi yang unggul dalam menopang sistem pembelajaran sehingga lebih efektif dan efisien. Unisula juga didukung berbagai infrastruktur berstandar internasional dan memiliki fasilitas pembelajaran unggulan yang terintegrasi di areal kampus seluas 40 hektar di kawasan Pantura, Semarang yang sangat strategis dan mudah dijangkau dengan berbagai moda transportasi. Dengan pola pendidikan dan berbagai keunggulan pendukungnya, tidak mengherankan jika saat ini para mahasiswa Unisula telah mencatatkan berbagai prestasi nasional dan internasional di berbagai kejuaraan, seperti kompetisi robotik, desain jembatan, olahraga, seni, dan berbagai ajang bergengsi lainnya. Dalam rentang perjalanannya yang panjang, Unisula terbukti berkontribusi penting memajukan pendidikan di Indonesia. Kami mengucapkan terima kasih atas kepercayaan yang diberikan. Mari senantiasa percayakan pendidikan Anda dan putra-putri Anda di kampus Unisula, kampus Islam terakreditasi unggul yang terus berikhtiar mendidik para mahasiswanya menjadi pribadi-pribadi yang kompeten, pribadi-pribadi yang birrul walidain, generasi terbaik, generasi khairul ummah. Sungguh beruntung orang-orang yang beriman kepada Allah. Sungguh beruntung pula orang-orang yang senantiasa menuntut ilmu, karena mereka sedang mendaki menuju derajat yang lebih tinggi. Sebagaimana yang telah Allah janjikan dalam Al-Quran Surah Al-Mujadalah ayat 11, yang artinya, niscaya Allah Subhanahu wa Ta'ala akan mengangkat derajat orang-orang yang beriman di antaramu, dan orang-orang yang diberi ilmu beberapa derajat. Universitas Islam Sultan Agung Unisula yang didirikan oleh Yayasan Badan Wakaf Sultan Agung pada 20 Mei 1962 di Kota Semarang, Jawa Tengah telah berkontribusi penting di dunia pendidikan dan kini terus tumbuh dan berkembang, bertransformasi menjadi Universitas Islam terbaik di Indonesia. Alhamdulillah saat ini di bawah kepemimpinan Rektor Profesor Dr. Gunarto SH.MH, Unisula berhasil meraih akreditasi unggul dari Badan Akreditasi Nasional. Dalam proses pendidikannya, Unisula yang berbasis Islam berkomitmen penuh mencapai visi mewujudkan generasi Khairul Ummah. Generasi Khairul Ummah merupakan generasi terbaik yang dicita-citakan, generasi yang beriman, bertakwa, beramal soleh, menyeru kepada kebaikan, dan mencegah kemungkaran. Untuk mencapainya, Unisula senantiasa istiqomah menerapkan budaya akademik Islami serta konsep kampus Birrul Walidain, sehingga diharapkan akan tumbuh generasi yang kompeten, berhati mulia, juga peduli dan berbakti kepada kedua orang tua. Di usianya yang lebih dari 60 tahun saat ini, Unisula memiliki 40 prodi yang mayoritas terakreditasi A dan unggul. Selain terakreditasi nasional dari BAN PT, sebanyak 13 prodi di Unisula juga mendapatkan akreditasi internasional dari Accreditation Service for International Schools, College, and Universities (ASIC) yang berbasis di London, dan terakreditasi dari The Alliance on Business Education and Scholarship for Tomorrow, a 21st Century Organization ABES 21 yang berpusat di Tokyo, Jepang. Unisula didukung oleh para pengajar terbaik di bidangnya, yang telah mengukir berbagai prestasi nasional dan internasional. Unisula juga terus berkomitmen memberikan layanan pendidikan terbaik dengan meningkatkan kualitas sumber daya insaninya. Salah satu ikhtiarnya diimplementasikan melalui program mencetak 100 profesor pada tahun 2027 mendatang. Unisula merupakan kampus teladan dalam pengelolaan kampus yang ramah lingkungan, berkelanjutan, dan berkomitmen mewujudkan kampus yang green, eco, dan smart. Memiliki teknologi informasi yang unggul dalam menopang sistem pembelajaran sehingga lebih efektif dan efisien. Unisula juga didukung berbagai infrastruktur berstandar internasional dan memiliki fasilitas pembelajaran unggulan yang terintegrasi di areal kampus seluas 40 hektar di kawasan Pantura, Semarang yang sangat strategis dan mudah dijangkau dengan berbagai moda transportasi. Dengan pola pendidikan dan berbagai keunggulan pendukungnya, tidak mengherankan jika saat ini para mahasiswa Unisula telah mencatatkan berbagai prestasi nasional dan internasional di berbagai kejuaraan, seperti kompetisi robotik, desain jembatan, olahraga, seni, dan berbagai ajang bergengsi lainnya. Dalam rentang perjalanannya yang panjang, Unisula terbukti berkontribusi penting memajukan pendidikan di Indonesia. Kami mengucapkan terima kasih atas kepercayaan yang diberikan. Mari senantiasa percayakan pendidikan Anda dan putra-putri Anda di kampus Unisula, kampus Islam terakreditasi unggul yang terus berikhtiar mendidik para mahasiswanya menjadi pribadi-pribadi yang kompeten, pribadi-pribadi yang birrul walidain, generasi terbaik, generasi Khairul Ummah. Sungguh beruntung orang-orang yang beriman kepada Allah. Sungguh beruntung pula orang-orang yang senantiasa menuntut ilmu, karena mereka sedang mendaki menuju derajat yang lebih tinggi. Sebagaimana yang telah Allah janjikan dalam Al-Quran Surah Al-Mujadalah ayat 11, yang artinya, niscaya Allah Subhanahu wa Ta'ala akan mengangkat derajat orang-orang yang beriman di antaramu, dan orang-orang yang diberi ilmu beberapa derajat. Universitas Islam Sultan Agung Unisula yang didirikan oleh Yayasan Badan Wakaf Sultan Agung pada 20 Mei 1962 di Kota Semarang, Jawa Tengah telah berkontribusi penting di dunia pendidikan dan kini terus
It's about business. Please have a moment, please.
Cek.
Ya, sudah masuk Bu Nisa suaranya.
Baik, Bu Rina, terima kasih. Baik, saya ulangi. Assalamualaikum wabarakatuh.
Waalaikumsalam
Oh,
warahmatullahi wabarakatuh.
and for Her Excellency, to the Dean of Pharmacy, Dr. Pharmacy Saiswan Abdul Wahab from Department of Pharmacy Practice, Faculty of Pharmacy, University Teknologi, Honorable all this event. First, let's thank to Subhanahu wa Ta'ala who has given us some mercies and blessings so that we can attend this seminar. May always given to our Prophet Muhammad SAW, who has the darkness to the light. I am Nisa Bnasari. I'm in this afternoon. Welcome to this event, and we would like to thank everyone for taking time to attend a remarkable lecture by Dr. Muhammad Sahiswan from Malaysia with the title For Increasing Drugs Use Among Elderly in the Roles of Pharmacists. Audience, ladies and gentlemen, let's open this event by reciting Al-Fatihah together. Al-Fatihah. Thank you very much. Okay, audience, ladies and gentlemen, let's move to the next agenda as the Faculty of Pharmacy Unisula give full support of this event. I would like to invite of the Faculty Jayanti Pharmacist, Master of Science, to welcome all the participants here. Dr. Ina Wijayanti, Pharmacist, Master of Science, please welcome. The floor is yours.
Thank you. Can you hear me? Mrs. Nisa?
Yes, Dr. Ina.
Okay, thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good afternoon, Honorable to the speaker who will deliver the guest lecture material today, Dr. Muhammad Sahiswan Abdul Wahab from University Teknologi Mara. Nice to meet you even online. Honorable to all lecturers and moderator, Honorable to the student of Pharmacy Faculty of Unisula. Praise Allah Subhanahu wa Ta'ala who has allowed us to gather online in this guest lecture. This guest lecture is organized by the Faculty of Pharmacy of Sultan Agung Islamic University with the theme Fall Risk Increasing Drugs Use Among the Elderly, the Roles of Pharmacists. Considering the high prevalence and impact of falls among older adults, this theme is essential and relevant. Falls are the leading cause of injury and death among the elderly. One of the modifiable risk factors for falls is the use of certain drugs known as fall risk increasing drug or FRIDs. Pharmacists have a very strategic role in preventing and reducing the use of FRIDs among the elderly. Pharmacists can perform assessment, intervention, and monitoring of the elderly's medications, as well as educate and counsel patients and families. Pharmacists can also collaborate with other healthcare teams to perform the reduction of unnecessary drugs. Therefore, I appreciate the presence of speakers who will share their knowledge and experience about the role of pharmacists in managing the use of FRIDs among the elderly. I hope that this guest lecture can continue in the future. And also thanks the moderator who will guide the discussion. And of course, welcome and thank the participants who have registered and follows the guest lecture. I hope this guest lecture can run smoothly, interactively, and beneficially for all of us. I also hope this guest lecture can increase our understanding and knowledge about the roles of pharmacies in preventing and reducing the use of FRIDs among the elderly. I hope we can apply the lessons and inspiration from this guest lecture in our daily lives as pharmacists. Last, I hope you have a pleasant time while attending this guest lecture. May Allah Subhanahu wa Ta'ala always bless us all. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you, Yanti, Pharmacist Master of Science, for your warm welcome. And with that speech, now the guest lecture with the title "For Risk Increasing Drug Use Among Elderly, the Roles of Pharmacists" is officially open. As we finish our opening, so to the next session, I would like to invite Ms. Chilmia Nurul Fatihah, Pharmacist, Master of Science, as the moderator today. I will make brief introduction of Ms. Chilmia. Please, from operator committee to share curriculum vitae. Okay, I will make brief introduction of Ms. Chilmia. Her education background in social and administration pharmacy, and her research interests are in health behavior, pharmacy education, and pharmacy practice. Right now, she is lecturer and also secretary from Department in Bachelor of Pharmacy Sultan Agung Islamic University. She is graduate from Semarang and continue her master in Chulalongkorn University in Thailand. Okay, Ms. Chilmia Nurul Fatihah, are you ready?
Yeah, I'm
The time
ready.
is yours. Okay, the time is yours. Thank you.
Thank you, Miss Nisa. Is it audible? Is it audible? Okay.
Yeah.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Welcome to the guest lecture from Faculty of Pharmacy. with the theme for risk increasing drugs among the elderly, the role of the pharmacist. Silmi, I'm the lecturer in the Bachelor of Pharmacy program, Faculty of Pharmacy Unisula, and I will be serving as your moderator today. So you will be hearing a presentation from Dr. Muhammad Shaheswan, which usually we call Dr. Iwan, on this very timely subject. And I want to say hi to Dr. Iwan first. Dr. Iwan.
Yeah, hi. Very nice to see you.
Yeah, how are you?
I'm good, I'm good. Yeah.
Yeah, good. Okay, that
Anjir,
before we
isinya apa?
started,
APT.
before we started, we'll take a few minutes to read the resume of Dr. Iwan. Mind to share the CV, please? So Dr. Muhammad Shaheswan Abdul Wahab is graduated from Faculty of Pharmaceutical Science, Chulalongkorn University, and he got his Master of Clinical Pharmacy in School of Pharmacy and Medical Science from University of South Australia, and also he got his Bachelor of Pharmacy in UiTM in 2006. His working experience is the lecturer in Pharmacy Practice University Teknologi from 2010 until present. He's the Deputy Dean for Academic Affairs from 2020 until present. And before that, he was the Deputy Dean for Student Affairs in the University Teknologi Mara. And his research interest in geriatric pharmacy that we will discuss today, and also in herbal and dietary supplements, and also pharmacy education. He got notable publication in some journal, and also has so many awards and other publication in such as conference proceedings, books, and etc. I think that's enough for the introduction. Moving along to our session, please welcome Dr. Iwan, who will be speaking for us on risk increasing drug among the elderly and roles of the pharmacist. We have around 100 minutes presentation and will be followed by discussion in 30 minutes with the students and also academic staff. So Dr. Iwan, time is yours.
All right. Thank you very much for the introduction, Miss Sylvia. First of all, Assalamualaikum, and a very good afternoon to everyone, especially the Dean, Dr. Rina Wijayanti. I'm very pleased to be here today, especially for the opportunity to see my old friends back. We studied together in Chulalongkorn University. She was in the social pharmacy and administrative department, and I was studying in pharmaceutical care department. So it's very nice to see her again. Yep. And I also would like to thank Unisula for the opportunity to give a talk today on a very important topic, which is fall risk increasing drugs. And I would present this topic using my PowerPoint slide. And I also will go into certain websites as well to guide you through on certain aspect of fall risk increasing drugs. I am not sure if the duration of the talk would reach up to 100 minutes, but I think it's going to take about 1 hour. Yeah. All right, let me share my screen. let me try to share. All right. Can you view my slide?
Yeah, it's visible.
All right. So this is the topic that we are going to discuss today. Fall risk increasing drug use among the elderly, the roles of pharmacies. So again, thank you very much for the introduction. My name is Muhammad Shahizwan Abdul Wahab, and I'm from the Faculty of Pharmacy, University Teknologi Mara. So before I start my presentation, I would like to introduce you to my university, UiTM Puncak Alam, or University Teknologi Mara. And this is how our campus looks like. So it is located a little bit far from Kuala Lumpur, about 40 minutes from Kuala Lumpur, and we are surrounded by beautiful jungle. So I really like to invite every one of you, Dean Rina Wijayanti, Miss Silmia. If you have the opportunity, please come and visit us in UiTM Puncak Alam, inshallah. Okay, so basically, this is I just would like to mention that this presentation would take about 60 minutes. And I have no financial disclosure or conflicts of interest with the presented material in this presentation. So all of the materials in this talk is for education purpose only. So 60 minutes is the duration that this talk is going to take. But let me just remind everyone, there is a sad thing about these 60 minutes. It is because every 1 second, an older adult would fall every day. And every 20 minutes, an older adult would die from a fall, and many more are injured. So that means at the end of this 60-minute presentation, 3,600 older people fall, and 4 older people died because of a fall. So these statistics or data alone actually tell us that falls is a very important topic that need to be addressed by healthcare professionals, including pharmacists. And we need to remember that we as pharmacists have a huge role to play in fall prevention. So fall prevention is not just for doctors, it is also for pharmacists. Doesn't matter, pharmacists at the hospitals, pharmacists at the community setting can also help in reducing falls among older people. So between 0.85 and 1.5% of the total healthcare expenditure in Europe, North America, and Australia are fall-related costs. So when we look at this percentage, it seems low, isn't it? But it is actually among the 20 most expensive medical conditions among community-dwelling older people. So basically, falls would cost money. It has financial implications to address the consequence from a fall, such as injury, hospitalization, medications, and other expenditures as well. So let's see the prevalence of falls in Malaysia. So this is the data that I have compiled from studies that were conducted in Malaysia. So if we can see here, the prevalence of falls are quite different from one study to another. there is a study that showed the prevalence of falls was about 27%. And in another study, 13%. In another study, about 19%. Then we have another study, 17% of older people fell in the past 6 months. And this is one quite recent one. 18% older adults fall in the past 6 months. So the difference in the prevalence among studies is actually not surprising because of the different settings and the different type of population. So we would, of course, see variation in terms of the prevalence of falls among studies. But anyhow, the prevalence, from the prevalence data, we can see that falls is not something that is uncommon among older adults. So it actually happened among our older adults. So what about in Indonesia? In Malaysia, Indonesia has a bigger population, much bigger population compared to Malaysia. So what about the prevalence of falls in Indonesia? Actually, there are many studies that have been conducted in Indonesia setting, looking at the prevalence of falls among older adults. So this is one example of study that was conducted on the topic. And this study actually involved a huge number of population, about 7,000 adults were included in the analysis of the data. And what the researchers found out was about 13% had one or more fall-related injuries in the past 2 years, 14% among women, and 11.5% among men. And 7.6% had a single fall, and 5% had multiple fall-related injuries in the past 2 years. So now we know that falls among older adults in Indonesia is also something that is not uncommon. This is another study conducted in Bandung. You can see here that the prevalence of falls, 1 to 2 falls, is 20%. And from the data, the researchers also showed that some older adults had a falls about 3 to 5 times, according to this study. And you can see here, down here, they also look at the impact of the falls. And you can see here, 88% of those who have fallen actually are afraid of falling. And this is also a concern. And I would like to tell you why this is a concern when an older adults having fear to fall again. So this is basically the fall cycle among older adults or older people. So they fall due to they fell and they lost loss of balance, confidence, and they feel fear of falling again. And because they are afraid to fall again, they would restrict themselves from physical activities. Probably they don't want to move too much, or they just lie at home and do not want to engage in physical activities. And this can lead to reduced muscle strength, impact balance, and this further would cause abnormal gait, causing more instability. And this would increase their risk of falls. And what happened? They would fall again. And this cycle would go and go on, perhaps a few times. Yeah. So it is important to actually prevent fall at the very beginning. And for those who have fallen, we might want to prevent them from having fear of falling. This is another study that was conducted in Indonesia, but it involves participants from the community and also nursing homes. And you can see here that the prevalence was even higher than the studies that I shared earlier. So in this study, the proportion of participants who had suffered a fall in the past year was 30%. So that is quite a big proportion of older people who have fallen. So have we, as the healthcare providers, prevented falls enough? So we can see from previous studies, and these studies is from Malaysia as well. And this study reported the prevalence of recurrent falls, meaning that they have fallen, and then they see whether the older people fall again after their first fall. So what the studies showed was a lot of older people actually fell again after their first fall. For example, this first study showed that 1 in 4 older people who have fallen fell again after their first fall, and 1 in 2 in another study, and 7 in 10 in another study. So that means that there is still a lot of things that we should do to prevent falls among our older people. And this is, and the topic of falls and fall risk increasing drugs is very important, because we know that the numbers of elderly or older people in the world and in our country is going to increase in the future. So the percentage of older people globally would be 22% by 2050. And another example is in Malaysia. In Malaysia, the percentage of elderly population would be expected to be more than 15% in 2050. So what about in Indonesia? So when I look at this report, SMERU research report, it was stated that by 2050, the elderly population in Indonesia will reach 74 million, or around 25% of the total population. So, you know, we need to pay more attention to the healthcare of older people. We want to prevent any health issues in older people, and we need to be prepared to provide care for older people in the future. In the future, it is expected that we would encounter many older people who would need help from us, the pharmacists. So let's talk about the risk factors of falls. So the risk factors of falls are many. So it can be a history of falls, means that if a person has fallen, the risk of him or her to fall again is higher than those who have never fall or fell. The older they are, the higher risk for them to fall. If they have muscle weakness, they may be at risk of falling. Mobility limitations, if they do not move a lot, if they do not engage in physical activity, they are more likely to fall. Medical conditions, certain medical conditions, if they have visual problems, if they have dizziness, depression, dementia, incontinence, arthritis, and pain, all of these medical conditions can increase the likelihood of an older person to fall. And this and medications, yes, this is very relevant to us as pharmacists. We need to be aware that certain medications can increase the risk of falls among older adults. So these medications are commonly known as fall risk increasing drugs. And in the literature, there are also other terms that are used to refer fall risk increasing drugs. So some good news, some bad news and good news. So the bad news is the higher the number of risk factors here means that the higher likelihood for a person to fall. But the good news is if we can reduce the number of risk factors that an older person have, we can also reduce the risk of falling. So for example, if an older person have medical conditions, they have muscle weakness, and they use medications that can increase their risk of falls, if we can address the risk factors that is related to medications, we can actually reduce the percent of falling among them by reducing the number of risk factors. So there are several medications that are known to increase the risk of falls. So these are some of the medications that can increase the risk of falls among older people. Drugs such as diuretics, sleeping pills, antipsychotics, anti-epileptics, antidepressants. So these drugs are the ones that work in the central nervous system. Yeah. And how these medications increase the risk of falls? So basically, they increase the risk of falls by producing certain side effects that can affect the balance or the stability of an older person. So those drugs that can cause ataxia, impair psychomotor function, those that can cause orthostatic hypotension, drowsiness. Those drugs are the ones that can increase the risk of falls. And certain medications can also exacerbate existing syndromes. There are drugs that can exacerbate dementia, delirium, and urinary incontinence. And these drugs, when used in older people who are having these medical conditions, can also increase the risk of falling among them. So this is basically how fall risk increasing drugs are being classified. And this classification is by the National Board of Health and Welfare, Sweden. So they actually categorize freaks as the one that increase the risk of fall. The one that increase the fall risk, and the one that cause or worsen orthostatism. So if you can see here, those that are categorized as drugs that increase the fall risk are basically central nervous system drug, and those that can cause central nervous system adverse effects, and the one that are categorized as drugs that may cause or worsen orthostatism are antihypertensive medications. But there are also other class of medications such as antidepressants, because antidepressants can also cause orthostatic hypotension. One easy way for us to know more about drugs that are considered unsuitable for older adults, or drugs that should be avoided in older people with fall risk, is by referring to the American Geriatric Society 2023. So this one is the most updated one. You can search it online. It is freely available. And it is a very good source for us to know the type of medications that is considered inappropriate for use among older people. So in this, the BIAS criteria lists a lot of medications that is considered inappropriate for older people. And it also highlights certain medications that are considered inappropriate in older people with fall risk. For example, they highlighted here antihistamines, those first generation antihistamines such as brompheniramine, chlorpheniramine, dimenhydrinate. All of these medication can increase the risk of falls, apart from other side effects that are not suitable for older adults. It also highlights benzodiazepines such as alprazolam, clobazam, clonazepam, and it highlights that the use of these drugs can cause falls, fractures among older people. This is because older adults have increased sensitivity to benzodiazepines and decreased metabolism of long-acting agents. Benzodiazepine, such as zolpidem, are also highlighted as potentially inappropriate in older people, as it can cause delirium and falls. Other than that, the BIAS criteria also highlighted that certain drugs may not be suitable or should be used in caution in patients with history of falls or fractures. So examples of these drugs are anticholinergics, antidepressants, anti-epileptics, antipsychotics, benzodiazepine. So we can know here if patients have a history of falls, we want to avoid or try to avoid these medications. This is in terms of interaction. So the BIAS criteria also emphasize interactions that are not suitable in older adults. So for example, if an older person use multiple anticholinergics, meaning they use anticholinergics and they use another anticholinergic, there is a risk in there is an increased risk in cognitive decline, delirium, and falls or fractures. So it is important for us to minimize the numbers of anticholinergic drugs. So if you like to know more about the types of anticholinergic of drugs with strong anticholinergic properties, you can also have a look in the BIAS criteria. In general, there are a lot antidepressants, antiemetics, antihistamines, antimuscarinics, anti-Parkinsonian agents, antipsychotics, antispasmodic, and skeletal muscle relaxants have strong anticholinergic property. So if you, I know it is very hard for us to memorize the names of drugs, and it is also hard and difficult to memorize if these medications have strong anticholinergic properties or not. Therefore, you can also check the anticholinergic properties of each drug by using this anticholinergic burden calculator. So let me just show you the website. Can you still see my screen, Miss Silmi?
Yeah, it changed to
Okay.
the
Yeah, that's good.
browser.
So yeah, by using this calculator, you can just simply type in a name of a medication. For example, let's say metformin, and you can know that these drugs has an anticholinergic burden score of 1. What about chlorpheniramine? We know that it is a first-generation antihistamines, and it is a highly it's a drugs with high anticholinergic burden score. So there is also a message here. Your patient has scored 3 and is therefore at a higher risk of confusion, falls, and death. And the advice is to review their medications and, if possible, discuss this with the patient and all relatives or carers. And please consider if any of these medication could be switched to a lower risk alternatives. And if you realize that this is just for one medications, and we know that an older person usually take multiple medication, so you can calculate the anticholinergic burden score of a patient by adding all of the scores of the medications that the patient is using. So for example, this patient is also using metformin and also using tramadol, for example, and now the anticholinergic burden score is already 6. So we might want to look at to review this patient's medication. Maybe we want to change this chlorpheniramine to another medication. We can change it to the second generation of antihistamine, for example. Maybe we want to change it to cetirizine. And we can see that the total SCB score is now reduced. And maybe we don't want to use tramadol. So if suitable, maybe we want to use NSAID, for example, celecoxib. Yeah, it's the total anticholinergic burden score is still 3, but a lot lesser than the first list of medication. All right, so that is one way on how you can check to identify medications with high anticholinergic properties. Yeah, and the BS criteria also highlight the use of multiple central nervous system active drugs. So it highlights here that there is an increased risk of falls, of fractures with the concurrent use of 3 or more central nervous system active agents. So this is also something that we want to think about if we encounter patients who are using multiple central nervous system drugs. And on top of that, we also may want to pay attention to medications that may exacerbate medical conditions that can put older people at higher risk of falls. So remember when I mentioned earlier, there are certain medical conditions such as delirium, dementia, who are already at risk of falls. So if they are using medications that exacerbate those medical conditions, for example, drugs that can exacerbate dementia, drugs that can exacerbate delirium, there is a higher risk of falls among those patients. So these are some examples of drugs that can increase the risk of orthostatic hypotension. Dipyridamole, peripheral alpha-1 blockers, central alpha blockers, all of these drugs. And these are the drugs that can increase the risk of hypoglycemia. We know that when a person experiences hypoglycemia, there's a lot of things happen. Their balance are affected. They have tremor. They could not think very well. So all of these symptoms can actually increase the risk of falls of a person as well. So we want to pay attention to pharmaceutical products such as insulin, medications such as sulfonylureas. These are the medications that can increase the risk of hypoglycemia in older people. There are drugs that can increase the risk of urinary incontinence as well, such as peripheral alpha-1 blockers. And the risk of urinary incontinence would be much higher if peripheral alpha-1 blockers is used together with loop diuretics. So these medications can increase the risk of urinary incontinence, and urinary incontinence can also increase the risk of falls among older people. This is because older people would rush to the toilet to urinate, and there is a possibility that they fall in the process of going to the toilet. So this is another thing that we may want to think about. Yeah. So for the Beers criteria that I showed earlier, it is quite general. So it does not only focus on falls, but there is another tool that we can refer to. And the tool is called Screening Tool of Older Persons Prescriptions in Older Adults with High Fall Risk. So this tool, or also known as stop fall, include drugs such as benzodiazepine, antidepressants, antipsychotics, opioids, antiepileptics, diuretics, centrally acting antihypertensive, vasodilators used in cardiac disease, alpha blocker antihypertensive, alpha blocker for benign prostate hyperplasia, sedative antihistamines, and medications for overactive bladder and urge incontinence. So the tool lists these 12 drug classes in the tool. Yeah. So and it has been much easier if we use the interactive website of this tool. So it is quite straightforward. So you can visit this interactive website. I have given the link on my slide. And you can just click on the name of the drug class, for example, sedative antihistamine. And this website, we will guide you on how you can manage these medications. For example, after I have chose sedative antihistamines, so imagine we have an older patient in front of us, and he and she is using sedative antihistamines, and we do not know how we can manage this medication, to stop or not to stop, and if you want to stop, how we can do it. So we can use this website. So this website guide you on how to manage this medication. So if the patient is using sedative antihistamines, the website would ask you, can the use of sedative antihistamine be matched to an appropriate indication for prescribing? Meaning whether or not it has indication. So if there is an indication for use of the sedative antihistamine, the website would ask, is there a safer alternative, or could dose reduction be possible? So I know that there are a lot of other alternatives to sedative antihistamines, such as the non-sedative antihistamine. So I would say yes. So this is the advice given to manage the patient. In the case that chosen alternative may increase the fall risk, the patient should continue to be monitored, and the prescribing of sedative antihistamine should be done in stepwise manner. Wean gradually by 25 to 50% of the daily dose every 1 to 4 weeks. And after withdrawal or dose reduction, monitor change in symptoms. So for example, if the patient is using chlorpheniramine, so we need the prescribing should be done in a stepwise manner. So we cannot just stop and change the medication abruptly. So let's see example of another drug class. For example, opioids. If there is indication, we click yes. Is there a safe alternative, or could dose reduction be possible? Let's say there is no safe alternative. We can click no, and the website will also provide some recommendation on how you can manage the patient. So the advice include perform a shared decision-making with the patient and possibly another specialist, consider withdrawal if slow reactions, impaired balance, or sedative symptoms present, consider withdrawal if given for chronic pain, and possibly if given for acute pain. Also take patient goals into account. You could consider either to withdraw the opioids or continue their usage. So this website is very helpful for us to know what to do when we encounter an older patient who are at risk of falls and is using fall risk increasing drugs. Yep. So just to mention that the BIAS criteria is developed in the United States, and stop fall criteria is developed in Europe. So there is actually a need for us to develop our own tool. So I'm not sure whether there is a tool in Indonesia, but in Malaysia, a tool to that lists potentially inappropriate medications has just been developed, and it is called Malaysian Potentially Inappropriate Prescribing Screening Tool in Older Adults. The reason why it is good to have our own tool is because certain drugs available or listed in the BIAS criteria or other tools that are developed in the Western countries may not be available in our country. So again, I'm not sure whether Indonesia has your own tool, but if there is still not available, it means that there is a research opportunity probably from Unisula to develop a tool to detect inappropriate medications among older adults. So this Malaysian tool is actually quite similar to the other inappropriate prescribing screening tool. It also highlights certain medications that are considered inappropriate in patients with a history of falls or fractures, such as antipsychotics, benzodiazepines, opioids, and all of these drugs that are considered inappropriate among those patients. So remember that inappropriate medications or fluids are not only encountered in the hospital settings, it can also be encountered at the community pharmacy settings. So for example, if you are working in community pharmacy and all the patients may come to the community pharmacy and request for first generation antihistamine, or they may request for antiemetics. And you know that these drugs are highly anticholinergic and can cause sedation, confusion, dizziness, gait, and balance problems. And all of these symptoms can cause and can increase the risk of falls among older people. So even at the community setting, you can actually reduce older people's risk of falls by providing them with medications that are safer. So for example, if they are using first generation, if they request for first generation antihistamines, for example, diphenhydramine with an ACB score, anticholinergic burden score of 3, you can always suggest other medication. For example, non-sedative antihistamine cetirizine, which has a lower anticholinergic burden score. And antiemetic such as hyoscine hydrobromide would have higher anticholinergic properties. And you can always suggest alternatives such as metoclopramide, which has lower anticholinergic burden score. So again, even if you are working in the community setting, you have a role to improve medication use among older adults. And this is important for us because we are the experts of medications, and at this point, it is evident that medications are also a risk factors for falls. So we need to be more proactive in preventing falls among older people. And this is, I would like to share with you the world guidelines for fall prevention and management for older adults. So this world guidelines for fall prevention mention a few recommendations that is very relevant for the pharmacists. So some of these recommendations include the guideline recommend assessing for fall history and the risk of falls before prescribing potential fall risk increasing drugs to older adults. The guideline recommend the use of a validated structured screening and assessment tool to identify threats when performing a medication review or medication review targeted to falls prevention in older adults. The guideline recommend that medication review and appropriately prescribing of threats should be part of multi-domain falls prevention intervention. So if you realize that, the recommendations here given by the World Guidelines for Fall Prevention can be actually performed by a pharmacist. Doesn't matter at the hospital or the community setting. So this is another publication regarding the management of fall risk increasing drugs. And this is by the European Union of Medical Specialists Geriatric Medicine section. You can have a look at this publication as well. And it includes ways on how we can manage a fall risk increasing drugs. Actually, it is quite similar to the one that we have discussed with the stop fall criteria. So basically by identifying threat, through medication review, and then we see whether there is an indication or not for the FRID. If there is an indication, we want to know whether there is a safe alternative or whether there is no safer alternative. So if there is a safer alternative, we want to change to that safer alternative. If there is no safer alternative, you can withdraw the FRIDs, but you need to monitor the symptom of the patient, or you can also continue the FRID, whether in the same reduced dose, with the same dose or with reduced dose. But whatever action that we do, we need to monitor our patients. I also would like to share with you the stopping elderly accidents, deaths, and injuries by the CDC. So this one is developed by the CDC in the United States. And they have come out with community pharmacy algorithm for fall risk screening assessment and care coordination. And I find that it is very easy to utilize this community pharmacy algorithm. So the algorithm start by screening our older patient. We want to screen for fall risk yearly. And we want to see if they are taking 4 or more chronic medications, or 1 or more high-risk medication, or any time patient presents with an acute fall. So we want to ask them 3 questions. If they have all of these, if they are using multiple medications, if they are using 1 or more high-risk medications, or if they had a fall, we want to ask them 3 questions. Whether they feel unsteady when they're standing or falling, if they are worries about fall, and if they have fallen in the past 1 year. If they are screened as not at risk, we can still reduce their risk of falls by educating them on fall prevention. We can refer them to community exercise or fall prevention program, and we need to reassess them yearly. And if the patients are screened at risk as having at risk of fall, we may want to review their medications, identify any drug-related problems with their medications. We want to know more about their postural hypotension, if they are experiencing lightheadedness or any other symptoms of postural hypotension. And we can also educate them on fall prevention and refer them to community exercise or fall prevention. On top of that, we may want to collaborate with the physician, the doctors, so that their risk of falls can be reduced. The Steady RX also have provided the community pharmacy fall risk checklist that can be used by pharmacists at the community setting to identify fall risk among patients, and also for them to collect data on the type of medications that the patients use that may increase the risk of falls among the patients. So the questions here, are we ready to provide our service? Are we ready to prevent falls among older people? So unfortunately, I think that our awareness about falls might be still still low, and our confidence in managing older people, as reported in a lot of studies, showed that our confidence is still low as well. For example, in this study that I have conducted among pharmacy students and pharmacists, the confidence of pharmacists to provide suggestions and opinions related to medication appropriateness and to identify drug-related issues specific to the elderly was seen to be a little bit low. And you can see here, they have actually received limited geriatric pharmacotherapy education. And this is not surprising, because we know that our standard curriculum do not really put much attention to geriatric pharmacotherapy. We normally include the general pharmacology in our curriculum. Another study, this one is conducted by another group of researchers. They also found out that not many pharmacists receive a geriatric medicine training. And similar to our studies, a higher percentage of pharmacists. So in this study, they include both physicians and pharmacists. And in this study, a high percentage of physicians and pharmacists actually were not confident in prescribing appropriate medications for older people. And in this study, about 70% have never heard of the Beers criteria, the one that I mentioned in this lecture. And this is just to share our one of our latest research that I have conducted with my team. So we look at knowledge of community pharmacies regarding fall risk increasing drugs and fall prevention. So this study was conducted among about 300 community pharmacies. And we can see here that although certain medications were known by the community pharmacists that those medications can increase the risk of falls among older people, a lot of community pharmacists in the study actually did not aware that antidepressants, anti-epileptics, central-acting antihypertensive, diuretics, and overactive bladder and incontinence medications can also increase the risk of falls. For example, only about 40% said that they know that overactive bladder and incontinence medications can increase the risk of falls, whereas the other 60% do not know about this. And this is quite worrying as well, because in our survey, you can see here, just 36% of the community pharmacies said they know about the Beers criteria, meaning that about 65% of the community pharmacies do not know about Beers criteria. Many of them do not know about the steady initiatives that I have shared earlier as well. Many of them, 80%, do not know about stop fall, and their knowledge about the other resources that can be used to learn about FRITS were also low. So it is important for us to educate our friends, our students, about the availability of these tools that can be used to identify and manage FRITS. And this table actually shows the community pharmacists' confidence in performing fall prevention activities, such as to assess fall risk, to assess postural hypotension, to conduct medication review, and all of this and all other activities that are relevant for fall prevention. Yeah, but you can see here that the mean is roughly around 4 or less. And this means that the confidence level of community pharmacists in performing fall prevention activities is not optimum yet. So there are still a lot of things that we should do to educate, to train pharmacists to perform fall prevention activities. So from the studies that I have shared in my previous slide, it showed that there is a need for us to educate pharmacists and to provide them training so that they can be more confident to provide appropriate medications for older people. So there is always opportunity to educate. And there are actually studies that have been published on the impact of pharmacist-led educational intervention on inappropriate medication prescriptions in older adults. So in this study, this pharmacist-led education intervention actually has led to the prescribing of 43% of sedative hypnotics users, 58% of non-steroidal anti-inflammatory drugs, and 31% of glyburide users. So this means that pharmacists actually can play an important role and can also be very beneficial in a fall prevention program. So basically, we as a pharmacist or community pharmacists, we should educate patients on fall prevention, especially about use of medicines and herbal and dietary supplements. We should review their medications and see whether their medications contain any medications that are considered inappropriate for them. Although we are pharmacists, we can also advise them to exercise and to refer them to community exercise or fall prevention program. So this is a simple exercise called as chair rise exercise that we can always recommend our patients, our older patients to do. So this is a very simple exercise in which the older people just need to sit and stand and sit again repeatedly based on their convenience and comfort. And I really like to share these pictures. It's actually was shared by a colleague. And Ms. Chilmia, I'm sure you remember our friend here, Dr. Pramon, and he was involved in a lot of community exercise program at Chulalongkorn University. What I like about the picture is Dr. Pramon here, he's a pharmacist and he led the exercise program. So that is a wonderful thing to see. So, and you can see here, this older man here could not stand, but he still exercised while he is sitting. So exercise is definitely for everybody. It's not only for those who can stand and walk or run, it's for everybody. And remember, you as a pharmacist can get involved too. Doesn't matter if it's just an education to exercise, just an advice to exercise, or you can also lead an exercise session or program like what was done by Dr. Pramon here. And then you also may want to increase awareness because, like I said, awareness about fall prevention is still low among older people. and the awareness of the role of pharmacists in fall prevention is also low. So we want to educate older people, their caregivers, and other healthcare professionals. And it's a good idea to educate our colleagues, such as doctors and nurses as well, of our role in fall prevention, so that they would know that we can contribute in fall prevention. And we want to support and stimulate the implementation and dissemination of sustainability of evidence-based falls prevention program. And last year, we also have developed a booklet concerning medications that can increase the risk of falls in older people. So this is a project by my master's students. And recently we won a silver award in an innovation competition. So this booklet is called Panduan Penggunaan Ubat dan Pencegahan Jatuh untuk Warga Emas. So warga emas, I'm not sure whether Indonesian use this term, but warga emas in Malaysia means older people. So this book contains information about falls, the complication for falls, and how to prevent falls. It also includes information of certain fall risk increasing drugs such as antihypertensive. And we also include in the books how the medications can increase the risk of fall and what they need to do if they are using the medications, or if they experience any adverse effects from the use of the medications. So this is another thing that we can do for our community, another thing that we can do for our older people, so that their awareness of fall prevention and fall risk increasing drugs can be enhanced. And remember to keep campaigning about our roles as a pharmacist. Our roles as a pharmacist in fall prevention. Campaign to the patients, campaign to the doctors, campaign to the nurses, and be more proactive in fall prevention. And lastly, I would like to share our future projects. Some of them are currently being conducted at this moment. So we want to see the use of freights among hospitalized patients. We have already conducted a study and collected data on fall risk among community dwelling older people. Currently, we are developing a flip chart as a pharmacist guided education material on fall prevention. And very soon we are going to start a study that look at the impact and effect of pharmacists at nursing homes to improve medication use among older people. We already have conducted two health campaigns in promoting fall prevention awareness among older people. And currently we are analyzing the data to see whether those health campaigns is effective or not. And we also are going to conclude a study on the impact of training on pharmacists' knowledge regarding freights. And I would like to take this opportunity to invite Unisula. If you would like to collaborate in any of these projects, I would be very grateful to collaborate with Unisula. In the past, I have collaborated with Ubudia in Aceh and also with UNER in Surabaya. So I'm very happy if Unisula could collaborate with us as well. And yeah, we welcome for collaboration with Unisula. And before I end my presentation, I would like to share this quote. It takes a child 1 year to acquire independent movement and 10 years independent mobility. but an older person can lose both in a day. Means that it takes years for us to learn how to walk and how to be stable, how to balance ourselves, right? But just one occurrence or just one fall can take all those away from an older person. And these are some interesting resources that you can look at if you are interested in fall prevention. And I guess that is the end of my presentation. I would like to thank for your attention. And I would like to pass it back to Miss Silmi.
Thank you, Dr. Iwan. So it's very interesting how the way Malaysian calls the elderly as warga emas, because it means the golden age or something. And it shows how the Malaysian really treasure the elderly as the valuable citizen. In Indonesia, we call them as the lansia, lanjut usia.
Lansian.
Yeah,
I
lansia.
see.
Yeah. So let me summarize some of the points that presented by Dr. Iwan. So it's in the concerning for us because the medication used in the senior, because in Indonesia, the elderly will become the 25% of the population, and they also take the multiple medication at the same times. So some of the medication could increase the fall risk, which could impact on the afraid of falling, that could increase the risk of the falling more. And Dr. Iwan also insists on how important the pharmacist's role to prevent the elderly from falling, such as by increasing the awareness by educate them, educate the healthcare professional and also the caregiver. We can review the medication and also reassess the patient. And Dr. Iwan also give us some research idea, which I really appreciate. Thank you so much for the propose some collaboration. We would like to have some collaboration in the future. So we would like to invite the students and also the guests to give question for Dr. Iwan. You can simply write the question in the chat box, or you can raise your hand if you want to ask directly. I think we have already some question from Rima, pharmacist Rima. How do pharmacists in Malaysia act on elderly? If the medical adherence is low, they take medication irregularly, so the readmission because relapse. I think they ask question about treating the low adherence in Malaysia. What do you think, Dr. Iwan?
Yeah. Low adherence. Actually, this is a problem everywhere, right? Not only in Indonesia, not only in Malaysia. I think this is a problem that happens everywhere. We still have we still have problems on how we can improve adherence among older people. Yeah, but again, we cannot just let it go. We need to always play our role by providing advice, try the hardest that we can do, provide them with the pill box, for example, patient education. Those are the kind of things that usually done by pharmacists here in Malaysia. There is no special ways to address that issues. I think it's quite similar as in other countries.
Thank you, Dr. Iwan. Another question from Diana. She is one of our lecturer. Look around, many elderly people fall because they have comorbidities such as obesity, diabetes, hypertension, and cardiovascular disease. By looking at the materials, there are lots of medicine to treat. The first question is, what is the rational management of therapy to reduce the risk of fall in elderly by minimizing the side effect? And the second one is, if based on the assessment, the elderly fall history, medication is recommended, we know that the drug metabolism process decrease and cause the DRP or drug-related problems. How to manage it all? What do you think?
Yeah, it's quite unavoidable, right, for older people to use multiple medications. They can present with diabetes, they can present with heart failure together with hypertension. So they would use a lot of medications. And it is very hard for us to stop a fall risk increasing drugs, right? We cannot just stop antihypertensive for our patients. That will be much dangerous for the patient. But what we can do is to see, from my lecture just now, there are certain medications such as antihistamines, which has alternative that is less sedating. We can see whether we can reduce the dose of certain medications. Those are the things that we can do for our patients. And we know that older people also, because they are older, they have changes in the pharmacokinetics due to their physiological change. And we know that they can tolerate a lower dose compared to the younger people. So why not we see if lower dose for them is suitable or not, and if yes, then maybe we can continue using the drugs at lower dose.
Okay, so I hope that answered the question from Ms. Diana. The other question from Pipit, she's from the 4th-year student. How long the effect of the fall appear?
Lah, tadi kenapa kamu ngirim screenshot?
Mine to mute. Okay. The question from Pipit, how long the effect of fall appears in someone who used the medication with Fred? Is there a certain dose range for the drugs that cause a fall effect? Is there any correlation between the dose and also the risk of falling, Dr. Iwan?
Yeah, I think there should be a relationship between the dose and the adverse effects, right? So of course, if the dose is higher, for example, if they are using benzodiazepine, if the dose is higher, meaning that there is a higher risk of central nervous system adverse effect. So yes, I'm sure that there is a relationship between dose and adverse effects that can cause falls. And how long? Let me just read the question again. How long is the effects of falls appear? Yeah. So it depends. Actually we want to know how long the adverse effects last from the use of the medication. Yeah, some medications we know, such as benzodiazepine, they are lipophilic, right? And it takes longer for those medications to be removed from the body, especially in older people, because we know that their body composition is also different than us. They have higher amount of fatty cells and other metabolism and other metabolisms are also reduced in older people, such as in the liver is also reduced, in the kidney is also reduced. So there's those side effects, those adverse effects in older people, we can anticipate to be longer in older people. Yeah. So basically, there is a relationship between those and adverse effects, and how long does the adverse effects appear? It would depends on the medications, and it depends on how well their organ functions.
So it's definitely will be different case by case because of the medication taken, and also the condition of the patient could be
Correct,
different
yeah.
from each other.
And sometimes if they
Okay, the
use
other question,
sometimes if they
Dr.
use
Iwan, are you still connected?
yeah, I could hear you. Yeah. Am I can you
It's
still hear me?
freeze.
Okay.
It's freeze for a moment.
So I was
Um,
I was saying that there are a lot of factors that affect drug concentration in the body, right? It can also be due to another drugs, for example, drugs that can increase the concentration in our body. So yeah, it's not very simple. We need to think of a lot of other factors.
Okay. Another question is from student in the pharmacy internship, Amin. His question is about how is pharmacist's role in reducing the freight? And I think it's similar to the question from Aisha, our first year student. She asked about what education can pharmacists do so that the patient can remain compliant, and what prevention can be done. Maybe she asked about how to educate them. What exactly could we say or could we educate to the patient?
In terms of fall prevention, actually there are a lot. We can talk about medications. The CDC algorithm for community pharmacies is a very good resource to know what needs to be educated, what needs to be given to the patients. You can talk about medications, you can talk about fall prevention, and fall prevention are a lot actually. You can talk about how they arrange things at their home. You can educate them to have visual check, because we know if a patient have visual problems, they are more likely to fall. We can ask them, we can educate them about exercise, because by exercise, they would strengthen their muscle, and it would make them less likely to fall. We can even talk about their shoes, the use of walking aid. In retail pharmacy, in community pharmacy, sometimes some community pharmacies sells walking aid, right? We can also talk about that. If they really need walking aid, we can educate them to use walking aid. We can also talk about food, vitamin D, calcium. All of them can be given in patient education.
So there's a lot of things that we can talk during the education about food. Okay, I think one of the student, Hagia Sophia, raised her hand. Would you mind to open your mic? You can open your mic. Okay.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon for all this audience here and all of this lecturers. My name is Hagia, Faculty of Pharmacy in 2023 from Sultan, Semarang, Indonesia. I'm from first semester right now. So there are some questions that I want to ask it about the topic that we discussed today. So my questions are, can the medicines or the drugs can cause the effects fall, or maybe the depends effect for geriatric patients, or maybe it can be occur at any age, who takes or who consume all of this medicine, who has a risk of increasing the fall effect and dependence effect for them. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Do you get the question, Dr. Ewan?
Oh yeah, can you summarize it for me, please, Miss?
She asked whether the medication that increase the falling of risk in the elderly also happen to maybe in the adult or in other
I
age
see.
also
see.
fall risk.
Yeah, for sure. If because everybody reacts differently to medications, right? Even if you give me benzodiazepines, my risk of fall actually can increase as well, right? If you if I'm some people may tolerate differently to antihistamines, for example. If I'm using 8 milligram chlorpheniramine, and if I'm the type of person who cannot tolerate the side effects, I may be excessively sleepy. And imagine if I walk outside and feel sleepy, that can increase my risk of fall as well. So yes, it can happen to younger people as well. Yeah, and imagine if we feel sleepy and feeling if we feel sleepy and much easier to fall due to these medications. Imagine these medications are being used by older people, 65 years old, 75 years old. You imagine the extent of the side effects that it has on them.
I think is it answer, Hagia Sophia? That
Yes, sir.
yes.
Thank you.
Okay, you're welcome. Okay, is there any other question or is it? Oh, maybe last question from Miss Farah. Is the ACB calculator measuring tools for prescribing cholinergic drug used by pharmacy practitioner in Malaysia? In pharmaceutical care, is it used by the general pharmacist there or?
Yeah. Some pharmacies use it. In Malaysia, we have a group of pharmacists who are quite specialized in geriatric care. It's not very, I think is not very established as in the Western country, but we have started, I've seen a group of pharmacists who are specialized in geriatric care. So I see that they use it a lot. The ACB, stop fall, abuse criteria, all of those tools that I shared are being used a lot when they review cases of geriatric patients. Yes, and of course it can be used by the general pharmacies as well.
Okay, thank you so much, Dr. Iwan. I think all of the question already answered. And would you mind to give some closing statement about today lecture?
Yes, my closing statement is that remember that we pharmacists, pharmacy students, remember that we have a role in fall prevention. We need to remember that the number of older people are going to increase. There will be more and more elderly or older people in the future. And by the time your students, by the time Unisula students graduated, there will be more older people that you would see in the hospitals and at the community setting. So we need to be prepared with the knowledge to help reduce health problems among older people. And remember that we are also going to be old, right? So we need to educate other people to care for older people so that they can care for us. All right. So pharmacists have a role in fall prevention, and let's do it together. Thank you.
Thank you so much, Dr. Iwan. I think today's discussion is very enlightening about the freight or for risk increasing drugs, especially in the elderly. Once again, thank you so much. I hope that we can see you again in either online or maybe offline, maybe in Puncak Alam or in Semarang, in Unisula. We will welcome you. And we may have some collaboration, whether in research project or in another lecture in the future. So audience, participant, please look forward to it. And we will go back to Miss Nisa SMC. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Ms. Chilmia and Dr. Muhammad Saheswan. And the next agenda is we will have certificate giving as token of appreciation from the Dean of Faculty of Pharmacy, Dr. Rina Wijayanti, Pharmacy Semester Osen, to Dr. Please, the committee operator to display certificate for Dr. Muhammad Saheswan. Thank you.
Okay, I want to express my sincere appreciation and gratitude to Dr. Muhammad Saheswan Abdul Wahab for providing invaluable knowledge and materials to all the students. Please allow me to present a certificate for Dr. Saheswan as a sign of appreciation and gratitude. Hopefully, this certificate will be memorable souvenir for Dr. Saheswan. Once again, thank you very much, and may Allah Subhanahu wa Ta'ala bless you. Thank you.
Thank you so much, Dr. Rina Wijayanti, as the Dean of Faculty of Pharmacy Unisula, and Dr. Muhammad Saheswan from University Teknologi Mara, Malaysia. And the last agenda is photo session. All of your camera committed to take screenshot for all of us. Thank you.
Anyone counting? Does anyone counting for the photo session?
Not yet.
Mind if I will count? Okay, so 1, 2, 3. Another photo, 1, 2, and 3. I think we have around 8 slides, or maybe the third slides. 1, 2, 3. Okay, that's enough.
Okay, thank you so much, Ms. Shelmia. Yes, ladies and gentlemen, we finally come to the end part of this event. Before I close the seminar, I would like to thank to Dr. Muhammad Saheswan as a speaker for informative introduction and to the very active participation. Hopefully, the guest lecture will be beneficial for everyone to hear. It's been such a great pleasure to meet all of you all, and thank you, and see you on the next event. Let's hopefully Don't forget to fill the absence in the link G form in the column chat. Thank you. I'm Nisa Abnasari. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you.
Thank you very much. Thank you. Thank you
Thank you,
for the
Dr. Muhammad Saheswan.
opportunity. Thank you.
Thank
so
you,
much.
Kak Iwan. See you again.
See you. Thanks.
Videonya sudah keluar. Alhamdulillah selesai satu tugas.
Bagus. Nggak di-mute.